Hi, I'm Michelle and welcome to today's Kegels for Women video, which is a little different to our regular videos. This is a response video to all your many questions and comments that you've posted on my Kegels videos over the past years. And I thought you might benefit from a summary of some of your most frequently asked questions and comments. So please feel really welcome to post further questions in the comment section below. I do read all your responses and I'm always really happy to help out if I can. So let's dive right in with your first most frequently asked question. And I've linked all these questions with timestamps below too, if you'd like to refer back to them at a later date. Usman asks, will the exercises be helpful if I have a bad prolapse? Yes, Usman, these exercises can help women with mild to moderate prolapse. Now, if the prolapse is so bad that it's actually protruding from the vagina, then it's unlikely that pelvic floor or Kegel exercises will make a difference. But in women with mild to moderate prolapse, yes, Kegels can have been shown in studies to make a big difference. I still get ladies that have bad prolapse or encourage them to do Kegel exercises if they can contract and exercise their pelvic floor muscles. Because if they end up having surgery, then the surgical outcome might be even better if they've actually got stronger pelvic floor muscles. So I think either way, you can't go wrong with doing your pelvic floor muscles, regardless of the state of the actual severity of your prolapse. Now, Reet asks, any exercises for vaginal gas passing? Okay, hi Reet. Vaginal gas, let me just talk about it a little bit briefly before we go into it and what causes it. Usually it happens because it's a bit of looseness in the front wall of the vagina. Sometimes it can be called a prolapse in the front wall of the vagina, but there's just a bit of laxity in the tissue so that the air can pocket in there and become trapped. So yes, Kegel exercises can help in that they can actually tighten the entrance to the vagina. They won't tighten up inside the vagina, that area that's become loose, but yes, they can definitely tighten the entrance to the vagina and decrease the amount of gas that's actually entering the vagina too and passing perhaps during intercourse. Now, our next question comes from Gaitari. And Gaitari asks, when can I see the results? Great question, Gaitari. It's what we all want to know, isn't it? This is really variable and it can depend on many factors, including how strong your pelvic floor muscles are to start with, through to how often you do your exercises. Now, some ladies will find that they notice improvements within a couple of weeks of starting their exercises, whereas for others it can take 3 to 4 weeks, maybe even longer, to even start to notice a bit of a change. I think the other interesting thing to note there is that if your muscles are really weak, studies show that it can take about 5 to 6 months of really dedicated practice to get your muscles strong again. So you're looking at some practice anyway to get your muscles really strong, but there's a big range there in terms of what you can expect. Now, Gabriel sent a question in, which I think is a really interesting question. Gabriel says, this is a sensitive topic, but I'll say it anyway. My partner keeps mentioning my loose vagina, and because I'm quite embarrassed by that, I'm finding ways to tighten things down there. I hope this exercise works for me. Thank you. Now, Gabriel, I'm really touched by this question for a number of reasons. I think there's a lot of issues related to this question, but I'll answer it first up in terms of the tightening. So yes, at the entrance of the vagina, doing your pelvic floor exercises or your Kegel exercises can definitely improve the tone and the muscle strength in around the opening of the vagina and a little bit higher up as well. So yes, these exercises can definitely help with that laxity. You might want to start doing them lying down and also practice them in sitting and standing, particularly standing upright, because the muscles have to work a little bit harder when you're standing upright as well. So you might make some even more or greater strength gains when you're standing as opposed to doing all the exercises just lying down. The other thing I'd just like to say is I can see that you're a very sensitive person. I really feel for you with this issue, and I think perhaps someone else in your relationship is being a little bit insensitive in pointing this out and making you feel bad about it. So I hope this helps you. I hope these exercises help you, and I hope these help you to move forward and feel good about yourself again. Janet says that I find while I do this, my abdomen is being pulled in too at the same time. Is that okay? Hi Janet, thanks for your question. Another really common problem, pulling in your tummy. So usually this happens when you start out with your Kegel exercises, and it can often happen because you try to contract everything, and it can be really hard just to isolate the pelvic floor muscles. So what a lot of women do is try to contract everything really strongly to get those muscles on. Unfortunately, when you contract the muscles, the upper abdominal muscles, upper outer muscles above your navel, these actually create a force downwards on your pelvic floor. So while you're trying to actually lift your pelvic floor upwards, your abdominal muscles are actually pushing downwards. So this is why it's really important to try to keep this upper area, your six-pack muscles, relaxed if you can. Now, what you might find is that the lower abdominal muscles, the muscles between your navel or your belly button and your pubic bone, develop a gentle tension, and this is quite normal with Kegel exercises. So down lower is okay, above, try to keep it relaxed, and you'll probably find that if you can actually do these exercises gently, relax your breathing while you do them, you can find that then you can actually focus more on your pelvic floor muscles and keep your abdominal muscles relaxed. So good luck with that. Now, Summer asks, if you put your finger in and squeeze and feel it around your finger tighten, is that correct? Yes, Summer, in part that is. So remember we've got the three pelvic openings. You've got the vaginal opening, you've also got the anus, and you've got the urethra. So we want all those openings to squeeze closed. You're right. So if you're using a finger against the wall of the vagina, yes, the vagina should squeeze shut. But you also should get an inward lift because there's two parts or two layers to these muscles. The outer muscles do the squeezing and the inner layer does a lifting. So to get the muscles really strong and working as they should, yes, squeeze first, and then lift inwards. So you're lifting up inside the vagina like that. So that's the action you're thinking of. And then lower it back down and relax. And that is your proper Kegel exercise. Our next question is from Duranceau, and I'll just go through this briefly. She asks, can I ask if I'm doing this right? I lay down flat with no pillow underneath my pelvis, and before I raise my pelvis up, I contract my pelvis and buttock muscles for 2 seconds. Then with these muscles contracted, I lift my pelvis up off of the floor for about 5 seconds, I think it is, and then raised state, I release the muscles and then contract again. And I do this for about 2 seconds. So I think the exercise you're describing is a bridge. And a bridge exercise is really an exercise that we do for strengthening the bottom muscles. So it's actually not a specific pelvic floor exercise. It's actually an exercise for your bottom. I've got a picture up here of a bridge exercise that you can see. And I'm pretty sure that's the exercise you're referring to. So that'll strengthen your buttocks. It's a myth that will strengthen your pelvic floor muscles. It won't. Pelvic floor muscle strengthening, you need to contract the pelvic floor muscles, not the buttocks. Now, our next question is from Bonnie, and Bonnie says, when I tighten, my legs automatically engage. Is this correct? Bonnie, that's again one of those global strategies that we use to try and contract the pelvic floor muscles when they're not as strong as what they could be, and we try to contract all the muscles. So really, we try to keep the thighs relaxed, the bottom relaxed, the tummy relaxed, and just try to tighten and squeeze and lift the pelvic floor muscles. Otherwise, we can mistakenly think that we're actually contracting the pelvic floor muscles when we're not. So then you don't get the right exercise going. So try to keep your thighs relaxed. You'll find that if you do a gentle exercise and really focus on the pelvic floor, you'll get the hang of just the pelvic floor, and you should be able to, in time, keep the thighs relaxed. Phoebe, our next question is from Phoebelyn, and I love this question. She says, will this work even when I'm already 45 years old? Well, Phoebe, yes. The really great news is that Kegel exercises can work for any age. I remember treating a lady who was 92 years old for her pelvic floor muscle weakness, and she made great progress. Pelvic floor muscles are like any other muscles in the body. When we don't use them, they become weak and they shrink. And when you do use them, exercise them at any age, they can strengthen. So yes, get into your Kegels. Now, the next question is a really important question, and I get this quite a lot. Sneha's asked, hello ma'am, I have vaginismus problem. My vagina is very tight. Which exercise would be the best for me? So, just in case you're not familiar with vaginismus, it's a spasm of the pelvic floor muscles, and it can cause pelvic pain. Some women will have issues or have difficulty having intercourse or having a vaginal assessment at the doctor's. Kegels will actually make this problem worse, so they're not the exercise to do because the muscles are already very tight and contracted, Instead of contracting them, the treatment is to learn to relax the muscles. Now, pelvic floor physiotherapists might be able to help you with that. Learning to do your deep breathing and learning to relax those muscles rather than contracting is the right treatment to go ahead with. And now this is our final question and comment today. There's a number of similar comments here. Charmaine says, Kegels are so hard. Ariseli says, am I the only one who can't do it? And then Fiona also says, I can't do it. Ashley says, that was hard. So I think you can see that many women find these exercises really difficult. They are not easy. I think part of the issue is actually finding and feeling the muscles first up, and that's the thing to really practice first of all. And there's lots of strategies that I've gone through in a number of videos. I'll link one above, how to find and feel your pelvic floor muscles. Things like sitting on a rolled up towel so that you can actually feel your muscles and have a reference point to lift away from. Using your fingers to actually feel the muscles contract inside the vagina. Lots of strategies you can actually use to feel those muscles and to know that you're doing the exercises correctly. And I think also too, knowing that you can actually see a pelvic floor physiotherapist who can help you find and feel your muscles. Once you've been shown those, often that's all you need, and you can then go off and exercise them as well. So in summary, I think you can see there's a lot of common issues women face with pelvic floor exercises or Kegel exercises. I really hope this FAQ has been helpful for you. I'd really love to hear from you if you've got any questions or comments related to today's FAQ, and maybe I'll do another FAQ if that helps. If it's helpful, please give the video a like below because that helps other ladies find the video too. Thanks so much for watching today. I'll see you next time.